All right, we have a ton of people online already, so I am thrilled. I am excited to be here with my friends from Amex Podiatry. Everything has been awesome with them so far this year, and they just keep cranking out good stuff. So I am going to turn it over to my friend John, and he is going to get started with a few announcements and good stuff, and then turn it over to our panel for tonight.
Yeah, guys, thanks so much. As always, it's great to see all the friendly faces on there. We appreciate everybody coming out and joining us. Tonight, we have a really special webinar, I think, where it's going to be a little bit different. We're not going to be focused so much on products, but we have four incredible podiatrists that are really paving the way in advanced cash pay modalities. So we get a lot of questions every week, guys. Like, everybody's super excited about the products, but everybody's like, how do I do this? How can I be better at this? How can I be more comfortable with this? So we thought of no better way than asking four of our good friends to come on and talk about how they're being so successful with the products. So before we have them introduce themselves, I thought I would ask my cousin and business partner, Jamie, to tell you guys a little bit about who we are, just in case you don't know.
Yeah, hey guys, I'm Jamie. Thank you all for joining. Thank you, Ann, for doing this again for us. These are awesome. We really appreciate the platform. Like John said, we're joined myself and Justin Hovey. Justin and I are brothers. We are cousins with John, and we are Amex Podiatry. For those of you who joined our past few webinars, John usually does the intro, but due to overwhelming audience feedback, I'll be handling it this time. So just kidding. John always does a great job. We're just changing it up a bit. For those of you who are new to us, again, we're Amex Podiatry. We are the master distributors for Liposana, DPMx, and now Cinepep BPC 157, which we're incredibly excited about. So we have a great portfolio of regenerative products. We're incredibly excited for this roundtable. So we really got the 92 dream team of podiatrists for this panel. With that, I'm super excited. Turn this over to our incredible medical director, Dr. Ho-Ellsworth. She's going to kick things off. As always, guys, after webinar, call us tomorrow, call us after tonight, email us. We're here to answer any questions and help wherever we can. Thanks.
We've got an amazing panel. I'm just going to have everybody introduce themselves. I think a lot of you guys who have tuned into a lot of the Amex webinars know who I am. I am practicing Dr. Thuy Ho-Ellsworth, practicing out of Austin, Texas. And I have basically tried to create my podiatry clinic as a regenerative space. And so I'm really happy and excited to discuss these with three other amazing podiatrists I've had the pleasure of working with.
Hey guys, I'm Speer. I practice out of Pensacola, Florida. I got into this right out of fellowship. I was at an industry-sponsored event, and they had a quick slide on what to do after flat foot reconstructive procedures. And I sat there thinking, why am I doing this? I'm in private practice. This is horrible. And so now all I do is regenerative medicine and MIS surgery, and I've never looked back.
Hey, Freels out of Lexington, Kentucky. I started my own foot care line called Modern Podiatrists. I've been in practice for almost 20 years at this point. And my whole goal is I actually quit doing surgery entirely like 15 years ago. And I've been biomechanics, sports medicine, so I'm a CPET as well. But yeah, I am leaning heavy into the regenerative medicine category because we were speaking earlier that, my patient demographic and my target demographic is that top 10% who, like us, have funds to spend on not just masking the pain, but also healing it. So this has been an easy transition for us in our practice, and it's gangbusters so far. So that's about it.
Joe Aoun. I'm the founder of Legacy Foot and Ankle in Michigan. We got a few locations here in Michigan, and then most recently we launched a brand new office pretty much about almost 3 months ago, dedicated to minimally invasive surgery in regenerative medicine, trying to bring patients innovative cash pay options to help them just recover faster, avoid unnecessary procedures, and just get back to the activities they love much quicker. Excited to join this webinar tonight and talk about my experience so far and the success we've seen.
So, I think it's obvious, right? All of us are frustrated. We're burnt out with ongoing declining reimbursements. So what can we do? I think it's important to understand that we can't let insurance dictate how we're going to treat our patients. We can't let them dictate what kind of therapy we're going to provide. And on top of that, patients are very educated these days. Information's at the tip of their fingers. They're seeking advanced options, and many of them are really willing to invest in these therapies that offer better outcomes, longer lasting results, and faster recovery. So I think it's really important that when we're offering regenerative modalities like these cash pay services, you're actually getting to meet your patient's demands directly. And for me personally, regenerative medicine has really transformed the way that I practice and deliver care and how I truly see the future of medicine. It reignited my passion for podiatry, and I am excited for the possibilities for my patients. So I'm excited to dive deeper with this amazing panel. And I would love for, no other person to kickstart this off than Carl Speer, because Carl and I did a presentation together in Florida about regenerative modalities. And I really liked Carl's insight on where he saw where podiatry was going and what he did, what he did to kind of change that outlook.
Yeah, I tend to be a little bit more bearish about podiatry than some of my buddies, but I kind of think of wealth as a couple of different things. It's money, time, and mobility, and you want all three of them. And this chart right here just really highlights on the first of them. So before I started doing regenerative medicine, if you look at the slide from December 22 to July 23, my average in-office collections were about 22,000, and that's we were collecting deposits toward deductibles, copays, and then kind of little stupid stuff like Tolsolin and Marigel kits. And then in August, we started incorporating DPMx in regenerative medicine, and our upfront collections more than doubled the very next month. It's even higher now. I mean, this slide is a year old. So this kind of speaks for itself, how much more we are collecting upfront. And then once you're collecting more upfront, you don't have to see so many patients in the office. Right now I'm only seeing anywhere between 20 to 24 patients a day. I have time to spend with the patients. The patients are happier. When patients are happier, staff is happy. And a lot of this regenerative medicine stuff, you can have your medical assistants run. So I'll go down to a conference in Orlando, and I'll have the practice running on Friday, and my medical assistants will be doing regenerative medicine, and I won't even be there. So it really frees up a lot of mobility and time for you to spend with your family. So it's been wonderful for me.
That's great. And I think to clarify what you mean by that is like they're running lasers or shock waves modalities.
Yeah,
that's exactly what I was thinking. I'm like,
yeah, I'll do the injections. Don't get me wrong, but they're doing the laser and the pulse wave therapy. Exactly.
Exactly. Yeah, I think it's a total game changer. For me personally, my personal logo has been changing the algorithm, transforming from being a very traditional practitioner to embracing all of these regenerative modalities, including shockwave, laser, red light therapy, DPMx injections, Liposana, and now peptides. How I got there wasn't overnight. It was a process. It was a change in my mindset. And it probably took me an entire year to really kind of get to where I got comfortable with it. And I'm still working on that. And I think for anybody out there that's looking to embrace these things, you don't have to overhaul your practice overnight. You can start with one protocol, one modality, and whatever script you're comfortable with, and then really grow from there. One of my, Joe is kind of a hero of mine, because when I see he's had multiple locations, but he took his practice from kind of more traditional practices. And I literally met you, Joe, last February or something this year. And he was kind of telling me about his practice. And then the more we talked about it, the next thing I know, this guy's opening up a new location and he's incorporated all of these modalities. Can you talk to us, Joe, a little bit about what you did to really kind of, and you're very conservative, you know, in terms of like making changes, but like a rock star, you turned around and you made it happen.
Honestly, I kind of felt like I really had no choice. One of the reasons I decided to start doing minimally invasive procedures and to bring regenerative medicine and cash-based services is because I was honestly starting to feel burnt out. I was considered very successful by my colleagues, but at the end of the day, I truly wasn't happy. I was losing that spark, the joy I had for seeing patients and really enjoying what I do. And I realized that if I kept going down the same path, it just wasn't sustainable for the next 10, 15, 20 years. So I made the decision to just do something different. And at the end of the day, I took a leap of faith, something that would bring, you know, some joy back into medicine for me, but also create better experiences for my patients too. A lot of people really try to focus on, you know, what is this going to do for me? But at the end of the day, your patients truly enjoy it as well. With minimally invasive procedures, I get people really life-changing outcomes with less downtime, less disruption to their lives. And with regenerative medicine and other advanced options, I can give patients treatments that don't just manage their pain, but also help them truly heal. And since making that change, it's been incredible. It really reignited why I went into medicine in the first place. And now I can honestly say I truly love what I do again, and I mean it.
Yeah, I love getting text messages from you that like you literally pump me up, dude. But you know, because you get so excited about it, and I love feeding off your energy as well. But I think that's the overarching theme here is that patient-driven care, like what Joe is talking about. And I think if we don't, you know, if you stop and you think about all these things, it can get really overwhelming. But if you kind of make patient-driven care your main focus, it's really easy to embrace these things. And I think when it comes to incorporating regenerative products into your practice, I love that, you know, Dr. Nicole Freels, she's had a you know, a very established, successful practice in Lexington, Kentucky. She had been doing products like PRP, but all these other new products are relatively new. Well, you did do some peptides, but all these other products were relatively new. And I think you've even said, I heard you say many times that you've kind of moved from like doing PRP, which was like a lot more time consuming, to now using these implantable umbilical cord tissues like DPMx and Liposana. Can you share a little bit about what you've done to incorporate that and how you got so much and such a quick patient buy-in?
Absolutely. So the first thing I would say, it's definitely education forward. So I separate them. Initially, when I'm doing their HPI or whatnot, talking about like their priorities, is I'll ask them, you know, we can go the traditional medicine route, but we can also go this route. And it's kind of eye-opening how many people, me included, like I don't want a steroid injection in my knee after having ACL reconstructive surgery ever. We know what that does. So to me, if there's something out there, if I just explain to the patient what exactly it's doing and I give them both options, and it's literally, it's not salesy. You know, I'm leaning back in my chair, you know, I'm reading their body language, and I have a fantastic link. If you ever want to learn how to communicate effectively with your patients on body language, it makes your time in the room so much faster. But anyway, once I laid that out, and it was very matter of fact, this is available to us now. It wasn't, I mean, it was before, but it wasn't attainable. It wasn't financially attainable is what I tell them. But now athletes have had this. And yes, I've used peptides for 5 years. But it's very easy to do once you ask the right questions and you know, a little bit profile them, you know, with their HPI. Are they an athlete? Are they, you know, working at Toyota all day? Like, what is their life like? And then I present it in a fashion that is complementary to their lifestyle, because I already have that information. So I kind of, you know, kind of pinpoint what they have said already and then reiterate that. And so they say, number one, you're listening to me. You've already said that, even though I didn't say it personally to you, or maybe they did. But it's actually so much easier than PRP. Like, I wish PRP was dead now, because I hate doing PRP because it's time consuming. I have to schedule the patient back. DPMx, I think we have 10 over ordered because we know how many we can add on with that conversation. It's a 10-minute, whatever, a 10-minute warm up time. So easy. Like, I hate when people want PRP anymore because
Yeah.
it's just time who wants
Yeah.
to do that? So in terms of clinic flow, piece of cake, nothing, like 0 seconds on the clock to get that in there. And they're more than happy to do it. 100%. It's the easiest thing ever. And I agree with Joe and Thuy. It is or Carl, who was it? Joe, whatever.
Yeah.
About the passion of being a podiatrist again, doing it 18 years. I'm over talking about plantar fasciitis, but now I have like shiny new toys that work. And it's like a different discussion because we have the same conversation every freaking day. So now it's like something that I love learning about. So yeah, we onboarded like 4 new services or products in the last month. And this is just one of them.
That's amazing. Yeah, I love that. And, I think when I have doctors that are very intimidated by these new, like you said, Nicole, new toys. If you guys can go back to that slide real quick. I think it's intimidating to have all these things and go, okay, I don't even know where to start, right? But and what are they and all this stuff. But I think the way that I have kind of get the message across to a lot of doctors that are reluctant is, if you knew the power of what orthotics did, or like a matrixectomy or anything like that, and say that was your new toy and you knew how well it worked, you're not going to refrain from offering that. And so, I kind of came up with this, like in 5 years, not offering regenerative therapies will be like not offering orthotics today to your patients. It is going to be an expected baseline care. And I think if you don't start embracing it now, you're going to fall behind in kind of the leader of your industry.
100%.
I think when we talk about, again, all these modalities, from DPMx to Liposana, peptides, it does take a mindset shift. It, just like Nicole said, you've been doing this for 18 years and you're talking about the same stuff, stretching, shoes, so on and so forth. But these new things come in and you have to kind of really, you have to embrace it before you expect your patients to embrace it. And so I think for me, it took a big mindset shift. And in order to gain patient acceptance, you have to have clarity and purpose on what the product is and taking the time to educate. But you also have to come in and lead with confidence and conviction, because your patients are going to pick up on you doubting your own product. And so if you believe in your product, I don't ever promote anything I don't believe in. And so I think my patients feel that conviction. And in terms of getting acceptance, it's so much easier. So I think for this first one, Nicole, how did you drop that fear filter? All of us have that fear filter when it comes to adopting something new. How did you drop that for yourself?
I love to learn. And so for me, I arm myself with knowledge and data. And after researching this product, it was pretty obvious. And then when I had my initial patients that we had done come in, and I had a lady with actually a girl with tarsal tunnel. She had Ehlers-Danlos as well. She hadn't been to me, but had been elsewhere, treated for over 2 years. I did 1 DPMx injection 2 weeks ago, saw her this morning. Of course, she wore a boot, stayed off of it, whatever. And she's like, oh my God, because she has horrible PTTD, pes planus, all the things. And she's like, this is the first time in 2 years I have general foot fatigue. And she was like, it's a completely different pain. So I think once you talk to that first patient and you hear their testimonial, you will 100% be behind the science, because peptides have been around since World War II, right? So this isn't anything really new for us. We're just now able to implement it and have companies like this that are packaging it and giving us so many good protocols and knowledge about it. But it really wasn't, that difficult. If you have the knowledge and you understand that patient's job, what's happened, how long's it been here? I'm like, okay, so you've tried traditional medicine elsewhere for 2 years. That's not worked for you. Do you want to go another route? Or do you want me to do another steroid injection? It's up to you. I completely 100% just let them make the decision. And so they feel like, you don't have to make a decision. Like, well, I need to talk about my husband. I'm like, okay. I was like, I'm not going anywhere. So call me whenever you want. I'm like, clearly it's been here 2 years. It's not going anywhere either. So if you're not in a hurry, I'm not in a hurry. neither is it. So
Right. And that's
matter of fact.
Right, right. And it takes pressure off the patient, right? But kind of like what you said earlier, profile the patient, but don't profile the patient, right? Profile the patient and get an idea, read their body language and see what it is they want. But don't profile them by assuming what their patient, their finances are going to dictate their medical decision making. And so I think it's important. Don't let your patient's demographics or your assumptions of their demographics determine what you're going to offer your patient. Offer it to them and let them decide. So great point. And I think, you know, again, Joe, you know, embracing a fearless model, like what did you do in your, and to change that traditionalist in you? You're very analytical. You're kind of like one of those guys where you're cautious in making any big decisions before you know all the facts. But what made you embrace kind of like this fearless mindset?
So Thuy, you know how calculated I am, and my patients also know that as well. A lot of times, patients are almost pushing me like, "Dude, come on, can we just do it? Can we just do it?" And so when I first came across DPMx, I honestly I couldn't believe, and this is how like naive I was until I started to meet providers like yourself and John and DPMx. Is I couldn't believe that there was a product out there that would give my patients a better chance to succeed, and I wasn't taking advantage of it. So as soon as I developed that mentality, things started to kind of click for me, because I felt like I wasn't being the best provider I could be for my patients. And when a patient comes into my care, especially for surgery, they're entrusting me not just with their foot or their ankle, but their ability to be on their feet, walk, run, work. And to me, that's sacred. It's not just about really repairing anatomy. It's about quality of life. And for that to happen, I thought the body needs the right environment to heal. You don't just plant seeds in dry dirt and hope for the best. It's kind of exactly how I view DPMx, especially in the post-operative process, which is where I've been most successful. 90% of my surgical patients are accepting of DPMx. I don't really look at it like a luxury or an optional add-on. If I deliver it as a maybe, at the end of the day, I'm doing my patients a disservice. They're going to hear optional, and most will not move forward. But my job isn't to give my patients hope for good results. My job at the end of the day is to help them achieve the best results. And that means I have to lead the conversation with conviction and clarity. This is what your body needs to thrive after surgery. This is how we can optimize your outcome. This is how I can protect your investment in your health. And if there's a tool that helps me do that better, safer, and faster, then to me, it's not optional at the end of the day. And if you're not providing it, or at least giving patients the option to have it, then you're doing them a disservice. And that's kind of where I'm at currently.
Yeah, that's amazing. I love that.
I agree.
And then, yeah, and Carl, I mean, you've kind of seen what life was like before regenerative and what it's like now, and you have a thriving 7-figure practice in Pensacola. But what have you feel like, how do you balance between like that mindset of, hey, I'm generating a lot of money for my practice, but also like, you know, do you feel like you're like selling, or are you like actually providing your patients with, you know, better options? Can you talk a little bit about that?
Yeah, absolutely. And I think when I first started doing this, my biggest fears were one, sounding too salesy. And then also, I think as physicians, we always want to just tell patients what they need, and we kind of have an ego to it. We just want to tell them, okay, let's just do an injection and then move on to the next patient, because we're so into this mindset of being volume oriented. But I've really come to the point now where to get these better outcomes, I let the patients decide what they want to do. I just lay it out there for them. I say, listen, there's a couple options here. You know, we could go the pharmaceutical route, which will probably mask the pain for a little bit. And you're probably familiar with that, with steroid injections and stretching and physical therapy and meloxicam. Or we can do regenerative medicine that heals the damaged tissue. And in my opinion, this is the most successful treatment. And I say the last thing, and I don't recommend this, and I think everybody should avoid this, is surgery. And 99.9% of patients are not going to want to do surgery. And I think that's a good way of not sounding salesy. You just at least it works for me, where I just throw it out there for the patients and then I let them make the decision. And most of them do go the regenerative medicine route when they're aware of the risks and benefits of all their options. And I think because you're giving them the option, the patient feels like they're more a part of their own decision making rather than the physician telling them what they need to do. So they're happy about it. I'm happy about it, and the outcomes are way better. And then, of course, it brings in revenue.
That's great. Next slide. Yeah. So I kind of want to get the here's a Shandu's question right here is the actual script. How are we communicating? This is my biggest question from every doctor I talk to is how do you relay this to the patient to talk? How do you bring it up? What's your script? What are your key phrases or key words? And so kind of what you already touched on, Carl, you said we can either go the pharmaceutical route or, you know, the regenerative route, right? And so, you know, chime in here, either Dr. Freels, Joe, or Carl, about how you communicate and what's your key phrases or words.
I actually love what Carl said about it. I'll put my marketing hat on here. So mentioning the word surgery is definitely a scare tactic that is effective because people are always thinking they come in and they're already thinking they have to have surgery. No matter what it is, they think they have to have surgery. So targeting that particular concern for the patient, I think is very effective. But to me, in terms of how I phrase it, it's really that you have two decisions. This has been here either 3 months, 3 years, 3 weeks. It's how do you want your treatment plan to go? Like I have everything, not everything, but I have a lot of what is new. It's in LA, it's in New York and Miami. Do you want to hear about that? Because we offer that in little old Lexington, Kentucky, which is unique. And so like Thuy, you know, putting us as the epicenter of regenerative medicine, biomechanics, and all of that in, you know, the state, it's going to be easier for us to bring patients in. But in terms of phrasing, it's those simple words. Is surgery a goal of yours? What do you do? Oh, you have 4 kids, so it doesn't seem like you have time to, you know, take the time to heal and be off of your feet for 2 to 3 months. So to me, I take what they tell me, I metabolize that down to their concerns, and I address on a personal note each concern that they have already mentioned. I'm regurgitating what they've said to me so they know I'm listening. And I have then angled it in a way that obviously is geared towards regenerative medicine, because for me, it's a no-brainer. Like, why take this medication if you don't have to, if this is available for me? And I'm sure we're all the same. Like, do you want an oral steroid or do you want something that's going like a laser therapy? It's a no-brainer. And those people just don't know those options are there. So to me, I feel like it's my job to educate them on what's available, even though I just take the insurance thing out of it. I just don't even mention it. And I think the next slide is talking about the if someone says, is this covered by my insurance? And so I'll address that then. But really, it's taking their keywords and their pain points, metabolize it, feed it back to them in an effective manner, and how it connects to regenerative medicine. That's it.
Right.
It's very simple.
How about you, Joe? How do you get 90% acceptance? What's your script, or how are you delivering it to your patients?
Honestly, it's kind of like I said recently. It's like for my surgery patients, it's just so easy. All of my surgery patients, they want to really put themselves in the best position to succeed, and if there's something that's available for them, they're not going to say no. Trust me. And what's crazy is before I started, I thought, who's going to pay for this stuff? And then I've come to realize that patients that I would have never thought and expected them to pay are actually paying for it. And so this whole time I'm like, man, was it me this whole time and not really my patients? You'll have Medicaid patients sometimes, right? Which I'm just going to throw that out there. I don't see any Medicaid patients, but you'll have Medicaid patients that will say, yes, I'll take DPMx. And I would have never thought that these patients would be willing to pay for it. But surgery is super easy. For my non-surgical patients, kind of like what Carl and Nicole were talking about, my non-surgical patients, the ones who are really trying to avoid surgery, it's a no-brainer for them. They always say yes. It's only the ones who truly, truly financially cannot afford it are the ones that are saying, is there anything else we can do? I'll do a steroid shot or anything like that. But honestly, it really is more so our mindset than theirs, to be honest.
So can I just real quick, just kind of talk about like what you said. You kept saying it's very easy. It's easy because you've worked up that patient's pain point. You know, same thing with Nicole, right? You guys took the time to ask your patient, how is this affecting your life? And what is your goal? My goal is to heal faster. I want to be back on my feet. And so that's really what makes it so much easier. Somebody in the chat just said, hey, I right away talk about it's not FDA approved or it's a cash pay. Why are you putting up a barrier right away? Like, don't even talk about those things. I don't talk about money. I talk about my goal. What is it you want? How is this, how it's affecting their life? Acknowledge it, empathize. And, you know, what if I said I can meet those goals, right? So I think it's important that, again, that putting that patient-centric question up front, don't create your own barriers. You're doing that by bringing those things in. Focus on the patient. Carl, what's your approach?
Yeah, 100%. I think one of the most important things is what you would call the discovery phase. And that's exactly what you were talking about, Thuy. You just sit there and you listen to them bitch about their problem, and you don't open your mouth until they're done. And you just take it all in. And you don't interrupt, and you absorb it all. And then once they explain everything, my favorite question I ask is, thank you for explaining all this. I just want to ask one very important question. How is this pain affecting you? And then that's a big pain point for them when you find out how it's affecting them. Oh, I can't play tennis. I can't do triathlon. I can't play with my kids. And if you really want to hit that emotional level. And then after they answer that question, then I say, okay, well, there's not just one thing to treat this. You have options, and there's good and bad to all these options. So let me just lay it out there for you, kind of explain to you what your options are, because I think it's important for you from a bird's eye perspective to see what you're looking at. Does that sound okay to you? And then the patient would say yes, and then I just lay out the options and let them decide.
Yeah, I love that. I love your approach of kind of taking it all in. I think anybody who knows me knows I love to talk. And one thing I've learned to do is shut up. I get in the room and I let my patients do the talking. I asked a few questions and I let them do all the talking. And you just sit back and listen and absorb. And they feel like you are, you finally, they get a provider that's listening to them. And it's easy for us as medical practitioners to go in there and tell them, this is what you need to do. And this is how you should do it. We need to stop that approach. And so I say, that's what I mean by flipping the script. Ask your patients those probing questions and get them to really tell you out loud so they hear it, you hear it, their pain points, and then asking them, what is your goal? That's my approach. And it's a lot like Carl, basically, but I love how you kind of sit back and acknowledge it and then thanking them, hey, thanks for telling me everything, but I have one question, how is this affecting your life? And I love that. I think it's just little subtle ways of asking that is so impactful. And so I think reevaluate your approach and how you talk to your patients. I'm not pushing products. I'm actually promoting goals and outcomes. And for me, my goal is always introducing these regenerative modalities as a first-line therapy. I flip the script by making my MAs go in after I've been in there to go through everything from stretching to shoes to lifestyle changes, avoidance, barefoot walking, all those things, right? They already have that in a packet. They share that with the patient. But for me, the time that I have with my patient is the time when I ask the questions, do you want to know what I have that can help alleviate this? And the patient's going to say yes. And that's when you introduce and talk about the regenerative modalities.
I also look at Thuy real quick. I look at their deadlines and time because I have a lot of people that are traveling and hiking and whatnot. And so if they come in, again, their HPI says, I'm going to New Zealand in 2 weeks or 4 weeks or whatever, then that approach is completely different. That's a forward, movement. Here we have a deadline. You're going to New Zealand hiking. This is what I would do because I've been in New Zealand hiking. This is what you're going to need to do. So this is what personally, but yeah, we can do steroids, whatever. Because I almost make it like nonchalant, like traditional medicine is out the window. And this is what we're here for. Because again, I can really focus in on that sports medicine component of it, especially for, obviously for my actives. And it's an easy sell. Just educate them on what it's doing. A big word I use is angiogenesis and explaining that. And to me, that really takes that higher level clinical, but makes it, a highway of circulation, whatever. And they're able to connect with that. And that's what they want. So deadlines, vacations, whatever it is. And then to me, my biggest trigger word is angiogenesis.
Right. And my biggest trigger word is investment. Right.
I love that. I keep forgetting to do that.
I love to tell patients this, that the word investment, I know I go through everything, all the pain points, and they offer it. And then when they hit you with the question, okay, so what does this cost? Does insurance cover it? And my statement will be, unfortunately, insurance doesn't cover it, but they don't always cover what's best for you. And I think that, in my opinion, this is worth the investment. And when you put it that way, I think it changes their perspective, because they've got to have some buy-in. And, and I think, I love that Amanda said that, Mudek here said that, that she started speaking more about it. The more you talk about this, the more comfortable you get with it. So start doing it now, start introducing it now. And every day is a new way of learning it. Somebody asked about, these modalities. So that brings us right into practice management strategies. So for me, I use a lot of these modalities. When I say these modalities, I'm talking about DPMx, Liposana, shockwave therapy, laser therapy. I combine, I package, and I bundle to give my patients the value, the perception that this is worth, however I've packaged it, there's a value in it. And I combine it with my MIS surgeries. And so let's talk a little. I think the biggest question everybody always has is, what are your packages and how are you pricing it? Because that's always the concern, like how much is too much and how little is too little. You don't want to devalue what you're offering, but you also want to make it available to your patients. So who wants to go first on how you package and bundle or price?
I mean, go ahead.
Oh, okay. I bundle everything. I always do everything before surgery. I'm actually, I should be like Joe and do it after surgery, but I've done everything before surgery. So no taken, thanks, Joe. But I bundle everything. I always do 7 treatments. So I'll do shockwave, then the injection, and shockwave, or that shockwave is laser. But it's always the injection on the 3rd visit. So 1 time a week for 7 weeks. For unilateral, it's 2,000, and for bilateral, it's 3,000.
That's great. Are you using laser too, or no?
Yeah, I actually use laser for everything except for plantar fasciitis. I use pulse wave for plantar fasciitis.
So you do shockwave and then shockwave followed by laser?
No, for plantar fasciitis, I just do shockwave and DPMx. And for everything else, I do laser and DPMx.
Okay, all right. What about you, Joe?
So I combo everything for me. I think that's probably the biggest advantage that you could have, especially when you're starting off, is that, just like you mentioned, Thuy, if you can give patients that feeling like they're getting a lot of bang for their buck, it makes it so much easier. So my non-surgical patients are always shockwave and laser combinations, and as well as with DPMx, and I'll bundle them all together and give them some sort of discount if they were to pay in full. And then my surgical patients, I always do laser DPMx. And I think probably the biggest thing that I would mention is, if you can throw in like 1 or 2 extra things that might not cost you much at all. I keep my bottom line with like the extras that I throw in under $100, right? So I can throw in a peptide, I can throw in a bone supplement. I give all my surgical patients a squid compression ice pack, so they use that. and they think they're getting maybe things that might cost so much, but really they don't. I mean, a supplement might cost you $30 to a patient. That's a lot, right? So if you throw in some extras, all of a sudden that packaging pricing of, let's just say $17.50 for your surgery patients, it ends up being a lot for them because they get so many things. They're getting laser, they're getting DPMx, they're getting a walking boot, they're getting a compression ice pack, bone supplement, peptide. I mean, there's just so many things that you can offer these patients. And trust me, at the end of the day, they're really not going to say no. Not many of them are.
Right, but they're getting that sense of value, but they're also getting that sense of like, man, this is very comprehensive and it covers everything, right? So I love that. Nicole, what about you?
I'm honestly pretty straightforward, and I don't mind it. I do it frequently, or in the past month, on the first visit. I'm like, this is what we have. I may have an extra one. I don't know. We usually pre-order these specials, but maybe there's someone that's coming in next week that I can give that to you. Our standard is $450 straight out. It's because obviously we're trying to maximize our revenue, and I love the idea of throwing in things that are $100, but our conversion has been fantastic on the first visit. Like I'm literally scare tactic, not recommending steroids at this time anymore. Period.
No, I agree.
Since if I've gone to DPMx, and I can confidently tell them within 2 weeks, you should be about 90% better. If you are not, we need to identify what you are doing, onus on them, what you are doing to trigger this, because that's a you problem. That's not a me problem. I've given you everything that you need. And now what's, creating continued issue. But honestly, like the outcome is so great. Like, I just don't even, I mean, I wish steroid would go away. And the best part is you guys are talking about laser therapy and all these packages, which is awesome. But I'm also thinking, I don't have Shockwave. I'm getting ready to buy one, but I don't have it. So to me, that's not really attainable. From a clinic efficiency perspective, DPMx is literally the easiest product you can onboard into your practice tomorrow. And if you don't have these other modalities, $450, it's, takes 2 seconds. It's like injecting actually takes a short amount of time to numb a toe for an ingrown than it does to inject this. So right. 0 pain points from a clinic perspective, maximum outcome and efficacy, 0, investment to a machine or something like that. So to me, this is easy to bring on. I love all the packaging, and I think we should create an Excel spreadsheet and share packages, but whatever. That's a future conversation.
Yeah. I think that when it comes to laser and shockwave, I got my shockwave from China, less than $2,000. Okay. And I don't know about Carl, what laser do you have? You have the Remy, right?
No, I've got the bougie. I've got the MLS.
Okay, you've got the MLS, and then Joe, you have what? Remy?
I have the Remy, and then I paid a pretty penny for my SoftWave device. So
right, and so I have an MLS and I have a Remy.
You can blame the Solutions Conference for that. They got me with that SoftWave.
Well, I got the SoftWave too.
But I love it. Thuy, I don't know if anybody else is using it, but I love that thing.
Yeah. So I started out with a Shockwave from China, and then I invested in the SoftWave. And I don't think you have to bring on any of these things. What my point is, you can start with a Shockwave machine less than $2,000 from China and combine it with DPMx, or you don't have to. You don't, whatever, work with what you have and start where you are. But starting is key. And so if you hear that everybody's doing these combination, it's something that I've built over the past 3 years as I've incorporated it and seeing it work. I do a lot what Carl does. I do 2 Shockwave, and I do laser. I do Shockwave combined with 5 minutes of Remy laser. I love my Remy. I have an MLS too. I use that for post-op, so it's not touching the patient, but I prefer my Remy over my MLS. But I train my staff to do those. I mean, I have 6 exam rooms and 1 OBS, and my shockwave and lasers are running nonstop. Patients aren't seeing me. My staff is doing it. And I think it's, you know, it's like work smarter, not harder situation. And I think that for me personally, I do a combination of when I do soft wave with laser, it takes maybe 10 minutes for my staff, but that's $1,000 package for 5 sessions. And then my DPMx, I charge $800 for my DPMx injection. So that's $1,800. And, you know, in terms of expectations on outcomes, Nicole is saying 2 weeks. I prep my patients. I tell them the difference, gone are the days of steroids. I hardly rarely use steroid. I think that is a very yesterday mindset. I think there's a place for it, but I think in what we do, I think those days are looking very, you know, it's gonna fade out. But I think that for me, steroids mask pain. So someone who's used to getting a steroid injection wants to come in, it's going to get that immediate relief. I said, it's going to mask the pain. Do you want to mask the pain or do you want to heal the pain? And if you're going to heal the pain, healing takes time. So I inject probably after, you know, 2 sessions or even first time like Nicole. It just depends on what my patients want. Again, patient-centric focus or model. And then I put them in a boot for at least a week or 2 weeks, depending on the severity of the condition. But you can expect anywhere between 2 weeks, 4 weeks, 6 weeks, 8 weeks. It varies from person to person and the condition. So I don't want to say, I don't ever give the patient a finite amount, but I think, yes, you still have to treat the underlying biomechanical condition, just kind of like what Nicole alluded to. But from what you can do and what you can offer that patient, they can expect anywhere in that timeline to actually heal their condition, right? So I
I
think
actually use it new. I have recently, as of the last couple of weeks, if I have someone with an elevated first ray and they're having mild synovitis, I will go ahead and recommend, like, hey, this is your future. This is where it's going to go. This is a sample joint or not of what it's going to look like with arthritis. If we can now inject this and get you a custom orthotic to plantar flex the first ray, we can now preserve range of motion and also reverse the joint damage that's already been done. And so I'm having people coming in and scheduling just for non or mildly symptomatic synovitis from hallux limitus. So that's another indication that's they love it.
right, yeah. The questions I always have from practitioners who haven't even incorporated these modalities. What if the patient asks why the patient, you know, insurance doesn't cover it? How do you avoid sounding salesy? What if they push back on the cost? And again, when they ask me this before they even brought these products in, the question I want you to ask yourself is, are these patient barriers or are they your own barriers, right? Are you putting up these your own barriers? Because if you're, I think it's good to be prepared on how to address these things, but don't let these overarching concerns be a reason why you're not adopting these modalities. So what do you do when you get pushed back, Carl, on the cost?
When they ask, like, why is it so expensive?
Right, like I can't afford that, like, you know.
Yeah. And I said that's totally fine. You still have your other options available, and if financially that doesn't work for you, then we just go down a different avenue.
Yeah, and I love that. I think Carl's answering it to how he's comfortable, and I think you should do the same. You shouldn't adopt somebody's script if you're not comfortable approaching it. Figure out a way. How would you want that answered, right? And maybe even look at yourself in the mirror and go over these questions and view your body language, how you approach, how you're promoting it to your patient is a really good way to analyze how you come across to your patients. But you know, and Nicole's already touched on how to avoid sounding salesy. I take the word sales completely out of my vocabulary, right? It's education, patient education and patient options. But Joe, what do you do if the patient asks why insurance doesn't cover it?
So I mean, I'm really straightforward with my patients, right? And I tell them the reasons why it's not covered. I don't really know, too much about, legislature and all that stuff and why exactly they don't cover it, but it's just not covered. But usually with my patients is I started off specifically with DPMx charging $400, and then I realized that really none of my patients were saying no. And so I think a lot of times you just put a feeler out there and you let your patients and the demographics that you're in dictate where you can price these things. And because no patient was saying no, I knew that patients were not asking questions. It was way too affordable for them. So I took the prices up a little bit. And then you kind of get a little bit of pushback. And maybe if you start off a little bit high, you're going to get a lot of patients asking these questions: why insurance doesn't cover it, how do you avoid sounding salesy, and then pushbacks. So if you bring those prices down, I think you'll kind of find a happy medium where you could avoid these questions and still be really successful. If you feel like you have it priced out right and it's still not moving, the only thing I could say is kind of what Carl mentioned. How important is it to the patient? If it's that important to you, then these are your options. It's kind of like myself. I went to physical therapy because John knows this. I have a bad shoulder, bad back. I feel like my body's falling apart. And physical therapist told me it's going to be this many sessions and this is how much it's going to cost. And I was like, holy crap, that's a lot. But then I asked myself, I'm willing to do anything to get this shoulder back to where I need it to be because it's debilitating. And I signed up and I paid for it, no questions asked. So one, allow your patients to pretty much dictate where that market moves for you and how to price it. And then two, ask the patient how important it is for them.
Yeah, I love that. And then, when it comes to the beauty of what, to me, when somebody brought up the FDA approval situation, the beauty of what Amex does is the products they carry, they're all FDA registered. And I love how responsible and ethical these guys have been. I've worked with John for over 10 years. Before, actually longer than that now, but before I started incorporating Amex products and John came up with this portfolio of things, but I had worked with him for 10 years. So I knew that he and I were on the same page in terms of, how we, like our medical ethics and our belief. But I think that, I think that's something that it shouldn't be a concern or a concern is the FDA approval thing, because PRP isn't even FDA approved, right? But it's important that it is a FDA registered product and how it's being processed. But I think ask yourself before, like, are you actually creating your own barriers on some of these things too? So,
I have
all right.
a comment on the insurance stuff. So my take is completely different from what you guys have all said. If someone asks me, like, is this covered by insurance? I say, because you never want to, from a body language, whatever perspective, you never want to say no, right? You just don't want to say no, because that immediately puts a barrier in that patient's mind. And it's kind of like, well, or a question. So I say, does my insurance cover this? Yes, some insurance companies do. With certain policies. That means HSA, FSA. So I've already got them thinking that this is possible for them. I've not said no. I mean, so I know that those particular plans cover that. So, and we said this earlier on our pre-whatever, but I said, we're kind of tripping over our own dick. So don't give them a reason to already have a negative connotation, because yes, they may have an HSA plan and it's covered. So you've already said, it's just kind of differing information. And then I say, the girls are going to come in, go over your policy with you, and just let them know what you want to do. If you want to do it today, if we have the product, I'll come back in and do it. No big deal. If you want a steroid injection, I'll come back in and do that. Whatever you want, just let them know what you want to do. And that's it. So I never say, no, your insurance does not cover this at all, ever. Because some policies do.
Yeah.
I
And
don't
I
know
think,
their plan.
yeah, I think too, what Joe is saying is if a patient is not accepting of it, then you need to reevaluate. What's your approach? How are you coming
Yeah.
across? Are you educating them, or are you asking the right trigger questions, right? Like what, what is your goal and how can I meet that goal? And what if I told you that I have something to help you meet those goals? And I think those are really, really good ways to kind of overcome that immediate objection. And so, and if they ask a question, kind of take the reins and ask a question back. Like, does it matter to you? Like, do you feel like insurance coverage determines, the quality of care? Like, kind of play that back on them a little bit, I think too. And make them answer some of the questions so that it makes them kind of trigger like what's important. And, oh yeah, that's true. Why am I letting insurance dictate what I'm choosing for me? This might very well be the best thing for me, even though insurance doesn't cover it. But when it comes to pricing, I did the same thing Joe did. I felt my market out. I started at $600 and I got like really high acceptance. But and then I raised it to 800, and that's where I get, there's going to be people that are going to say no, and that's okay. But I think it's important to not undersell yourself either and price it too low, because you have to take into consideration, like, gone are the days that we have to look at how insurance views us and values us. Like our worth is so much more than that. And we have to price ourselves at what we deserve and based on our training, all the things that we have to pay, overhead, etc.
And honestly, don't be afraid of these barriers either. It's going to happen. It just comes with our profession, right? Just understand that if you truly believe in these products, the way I believe in DPMx or any other regenerative tool I use, just know that you are absolutely benefiting your patients tremendously. So don't worry about these barriers. Just deal with them, tackle them as you go, and then eventually you'll start getting more and more confident. But don't let these barriers stop you from offering these to patients, because you're leaving that on a table for a lot of patients, and they deserve it at the end of the day.
I love
I
that.
personally think you're going to be antiquated if you don't onboard regenerative medicine. I think you're going to be one of those old fart podiatrists. Sorry, not sorry.
TFP.
If you don't do it, huh?
TFP.
That's right. So if you want to have some fun with us and learn regenerative medicine, then get on.
That was, yeah. Thank you so much to you guys, our panel. That was a fantastic discussion. You guys brought so much and more. So I love that. If you guys like this and want more, hit the heart on the bottom on the right. We can have
love
more
all these hearts. I love them.
Yeah, that's good news, right? That means everyone likes what y'all had to say. So guys, I do acknowledge that we're getting a ton of DPMx specific questions. My phone number is going to be on the next slide here. Please call out, call, text, email, whatever, and we will make sure that we get those questions answered. The intent of this webinar tonight wasn't really to be a product specific one, so don't think we were intentionally ignoring those. We'll be happy to get those answered for you guys tomorrow. But thanks so much to our awesome panelists. It seems like everybody really enjoyed this based on all the hearts, and we'll look forward to doing some more of these in the future.
Yeah, I think gone are the days. We need to change our profession. We stop being cannibalistic, stop being competitive with each other. There's plenty of feet to go around. I promise. I have a podiatrist on the second floor of my building. There is no competition. We work together. And so there's no reason why we can't collaborate. And you guys know, anybody who knows me has my contact information. I am more than happy to answer any questions, collaborate. There's no reason why we can't do that together, guys. We need to change our field and just work together on elevating our profession.
I agree. Quick plug, and Thuy's in there, and John as well, and Ann. Toe Tactics Podiatry Innovators Hub is a private Facebook group that I created. You cannot find it. You must search it or email me if you want access to it. But it's this talking about like nuanced stuff and podiatrists like actually supporting other podiatrists as opposed to eating their young, which we've all heard of. So if anyone's not heard of it, please join. We do all kinds of stuff all the time. It's free AI. It's like high level advanced stuff. So if you are in the past, then probably not the best group for you. But if you want to think outside the box and move your career forward, then join Toe Tactics. So
Yep, great
Yeah.
group. I agree. So thank you guys again so much. Thank you for everybody spending your Monday evening with us.
Sorry,
Hopefully everybody found
real
it.
quick. I think Ann's already sent it out, but there is a regenerative conference coming up. So if you guys want to, register for that, that's another way to learn about all these things as well.
Yeah, that's gonna be on the weekend of October 18th and 19th in Chicago. It's gonna be excellent. A lot of hands-on workshops, protocols, techniques, a lot of things you guys are asking about as well. And we'll
I
continue.
love that agenda. That agenda is locked up in terms of regenerative medicine. I think Sev's involved. Is that right?
Yep. Mhm.
Yeah, it's a fantastic agenda. I literally moved my entire weekend just to be able to come. So I think it's gonna be well worth it.
Yay. Good.
That's awesome. That's awesome.
Thank you
All
so
right,
much.
everybody. Thank you guys so much. Thanks to our panelists
John,
and
thank
our
you so much.
sponsor.
I appreciate it.
Good night,
Thanks,
everybody.
everyone.
Bye.
Thanks,
Good night,
Ann.
guys.
Bye, everybody.
Bye,
Bye,
guys.
everyone.
Guys.
Night.